This is Dr. Heilig with Short Orthopedics of Kentucky. I'm an orthopedist. I'm going to do a presentation on cubital tunnel release and what to expect with that procedure. Basically, it's releasing the ulnar nerve at the inner side of the elbow. It is usually due to compression on the nerve. Sometimes the nerve's unstable where it's flipping in and out of its groove. These things can cause numbness and weakness. Typically, we will get an EMG, electromyogram, where they use the little needles and probes to check the nerves in the arm to confirm this diagnosis. Sometimes the procedure can be done for recurrent symptoms. Some patients will get an in situ release where you just release the nerve but don't move it. We call that transposition. Sometimes you have to go back and do that if it doesn't take. Some patients will go back to doing the same activity that caused it in the first place and it'll come back on them. Usually this is 5 to 7 years down the road. Some things to know before surgery is nothing to eat or drink for about 8 hours before surgery. You should plan on not using the elbow or minimal use for about 2 weeks. I do allow a gentle range of motion, but nothing heavy. Good nutrition is important. This wound sometimes will have some healing issues, so you want to give it the best shot you can with a good diet. You also want to avoid smoking, which can affect the healing process. Recommendation is no smoking for about 6 weeks before surgery and about 3 months after surgery. You do want to follow your surgeon's instructions to the T to get the best possible result. There was a study done that showed up to 61% of surgeons reported inferior results with cubital tunnel release compared to carpal tunnel release. So it was helping, but not quite as good of results as the carpal tunnel. There are studies showing that in situ release works just nearly as well as a transposition. And there are fewer potential complications such as nerve injury or an unstable nerve. It's less surgery, so there's less healing that needs to be done. It's less painful. You can get inferior results depending on the severity. If it's a very severe cubital tunnel, the release may not work at all, or it may just help partially. Diabetics are kind of the same thing. If you have diabetes, the cubital tunnel release many times will help, but sometimes there is permanent nerve damage associated with the diabetes, and you will have some persistent symptoms even after the release. Wound care, typically when you wake up, you'll have just a soft dressing on the elbow. I recommend patients to take that off about 2 days after surgery. You can then wash over the wound with soap and water in the shower. Don't soak it underwater until stitches come out. I have you back to clinic about 2 weeks after surgery for stitches. You want to baby it while that wound is healing. No heavy stuff, lifting, pushing, pulling, as it can pull on the wound and potentially open it up. Pain control after the procedure. It is possible to do an anesthetic block. I don't routinely do these for cubital tunnel, but it is an option. Scheduled anti-inflammatories with alternating acetaminophen help with baseline pain, and then I will usually give a prescription for narcotic pain medication to be taken as needed for breakthrough pain. Splinting and bracing are options. Usually I do just a soft dressing, but it can be helpful with recurrent cubital tunnel or an unstable nerve, and it does help with the pain as well. Physical therapy isn't as important after a cubital tunnel release. I will usually just recommend some home exercises, typically just range of motion to keep it from getting stiff while that's healing. Passive range of motion initially, where you just move the arm with your good arm, and then active motion after about 3 or 4 days. No strengthening until about 4 to 6 weeks to prevent any kind of undue stress on that wound while it's healing. This concludes this report on cubital tunnel release. Please do not hesitate to contact me at Assured Orthopedics of Kentucky if you have any questions. Thank you.